Known as the land of 1,000 hills, Rwanda is one of the smallest countries in Africa and the continent's most densely populated. This small piece of land is also currently home to some 74,000 refugees, but this number could quickly rise if there is an emergency influx due to conflict in the region. Nearly all refugees in Rwanda are from the neighboring Democratic Republic of Congo, the majority hailing from Eastern Congo, which remains a volatile region of conflict even today. The government of Rwanda, through the Ministry of Disaster Management and Refugee Affairs, MIDIMAR, and the UN Refugee Agency, UNHCR, began opening camps for refugees fleeing to Rwanda in 1995. Those refugees are still here today, spread out in 3 older camps, Kiziba, Gihembe, and Nyabiheke. In the last 2.5 years alone, another 35,000 Congolese refugees have arrived as a result of the most recent fighting in DRC. In order to accommodate the new arrivals, 2 more camps, Kijeme and Mugombwa, have opened. As Eastern DRC remains unsafe for refugees to return home and with little prospect of finding permanent solutions in Rwanda due to shortages of space and limited income generating options, refugees are stuck in limbo.
Muri Congo.
As refugees prepare themselves for a long stay away from their home country, they must rely on support from the host government and humanitarian organizations to take care of their basic needs. MIDIMAR and UNHCR work in close collaboration with multiple partners to provide protection and support in vital areas such as health, water and sanitation, environment and education, to name but a few.
At UNHCR, we believe in the importance of cooperation among partners. We do the general coordination for the camp together with the government. MIDIMAR represents the government of Rwanda, and then we also have the collaboration of other partners. So UNHCR role is to coordinate all the work with these partners and the Rwandan government to provide the international protection that the Congolese refugees here in Rwanda need.
Life of refugee, I can say that is not a normal life. We have different challenges such as food, water, sanitation, house, and so on.
Unfortunately, maintaining the basic services for over 74,000 individuals on a long-term basis can prove to be challenging and costly. In addition, the local constraints do not allow them to easily benefit from the meaningful livelihood prospects, making them extremely dependent and vulnerable. Since these refugees share the same culture and language as the locals in Rwanda, a rational decision was taken not to run parallel systems, but rather to integrate the refugee program into the national systems, mainly in education and health.
It is the policy of the Ministry of Disaster Management to integrate refugees into national programs, and the effective implementation of that approach shall progressively depend on the available capacity. Where there are schools for the local communities, the refugee children also can attend the same schools.
Protection is UNHCR's key mandate, and with MIDIMAR, it ensures the protection for all refugees. Protection can mean being registered as a refugee, accessing fair legal procedures, or finding a long-term solution, to not remain as a refugee forever. In the area of protection, Midimar, UNHCR and its partner, Plan International, are prioritizing child protection, prevention and response to sexual and gender-based violence, SGBV, as well as ensuring the inclusion in all programs of persons with specific needs, such as those living with a disability.
I started in protection work because I really believe that all children deserve a fair shot at life. But the fact is that the camp situations, life isn't always safe.
The risks to refugee children in the camps are numerous and critical. There are also over 3,000 unaccompanied and separated children, 10% of all refugee children, who are living without the protective care of their parents. UNHCR, Midimar, and Plan are initiating a multi-sector system of prevention and response for child protection and SGBV to ensure that the risk is reduced and that when incidents do occur, the survivors receive necessary services.
Mbere byaje kuba intambara iba papa ari munka ngurembuza mbura umuntu tuzana sanora mu rugo baza kumfata ndi mu rugo baza kudukorera ibarura tuza kuzino kwezi kwa mbere nza kubyara ariko nta kintu nari mfite kubera ko nta mikoro nari mfite hasere iza kungana nshaka ibyibanze ubuzima buri kugenda bihinduka aho planiziye ingirira icyizere umufite icyizere cyo kubaho kandi nuko umwana wanjye azabaho kandi ubuzima bugakomeza nifite icyizere ko mu kwa mbere nshobora gusubira ku ishuri nanjye nkazagira wandi ikintu nzigezaho nyuma y'ubu buzima bubi nabayemo.
And what we're trying to do is we're trying to work with community-based protection mechanisms. So what that means is existing groups that are already within the community that refugees themselves have created to basically protect themselves, really trying to understand what they've done so far and working with them to really bolster those systems.
The long-term strategy is to ensure that the refugees are included in emerging national child protection and SGBV systems. Shelter is a basic need which is also inherently linked to protection. Ensuring adequate shelter can help protect refugees from SGBV and foster better family relations. However, currently many refugees are living in substandard, overcrowded shelters where children lack the space to develop in safety and dignity. Refugee response actors such as ARC are striving to meet the minimum standard for household space in the camps.
We face, especially in the camps, let's say Gihembe and Yabieke, which have been there for many, many years. The shelters are in very poor condition. You can imagine people who have been living there for over 17 years. Their shelters are damaged, their shelters need repair, and this is something ARC is taking care of. It is a challenge to do this for all the needs which exist in all of the 5 camps due to budget constraints. So we tackle the most urgent needs. And hopefully in the next years we can also, we make sure we handle all of the challenges there are.
In the midst of conflicts, education is often seen as a luxury, but education is a basic right, including for refugees. The refugee population in Rwanda is predominantly young. Currently, 56% are under the age of 18. Yet, only 60% of school-age children are actually enrolled due to a variety of barriers, For example, overcrowding in classrooms. UNHCR, in partnership with ADRA, provides free education to refugee children until grade 9 or lower secondary education. However, upper secondary remains available only in national schools, which are inaccessible to most refugee children.
Children are being enrolled from grade 1 up to grade 9, and we don't have upper secondary.
Nanjye niga mu mwaka wa gatatu. Umwaka uzaza ntago nzabasha gukomeza kwiga kubera nta wa kane tugira hano. Kandi nta n'ubushobozi mfite bwo bunjyana ahandi ngo njye gukomeza kwiga. Nifuza gukomeza nkiga amashuri nayarangiza nkakurikirana ibintu byo kuba umuganga.
The government of Rwanda has shown tremendous openness to fully integrating all refugee children into the national education system. However, additional finances are needed to build a national infrastructure that can include all refugee children. Currently, 40% of refugee students attend national schools, while 60% continue to be enrolled in parallel camp schools. The health of refugees is another key component of protection and a priority for UNHCR and MIDIMAR. The government has already taken steps to integrate refugees into the Rwandan healthcare system. Unfortunately, Rwanda's health centers are not fully equipped to accommodate the large numbers of refugees. The Kigeme District Health Center is a perfect example. It was only built to provide services for the local town's population of 8,000. Today, the refugee population in Kigeme is a staggering 18,000 individuals. As a result, refugee patients must pay high costs for treatment because they are not covered by the National Insurance Scheme for Citizens.
We have some challenge working here in Kigeme refugee camp, and the main challenge is on the maternal health. The maternal health service that we are providing is not enough because of the space. For example, for pre and post delivery, we need more rooms. Currently, we are using one room sharing with other inpatients.
Ikibazo duhura nacyo ni nk'uko ukaza ufite umwana urwaye irembye wagera hano ugategereza umwana arushaho kuremba akajya gufata umuti nyine wategereje nawe usa nkaho wahebye kandi umwana amerewe nabi arwaye.
Support is needed to boost local and camp clinics to adequately serve the refugee population. Water and sanitation are essential to life, health, livelihood and dignity, and is a basic human right. UNHCR Rwanda delivers a full wash package which includes water supply, sanitation and hygiene services through its partners. Nonetheless, wash services remain below the minimum humanitarian standard. For example, in the summer of 2014, refugees in Gihembe camp were only receiving 4 liters of water per person per day, while the minimum standard is at least 20 liters. A key solution is building a sustainable water supply system which would benefit not only refugees but the host communities as well. For example, in Mugombo camp, a temporary solution for delivering water was put in place, however, at a very high cost. In addition, the water source provides inadequate water, both in terms of quantity and quality. To resolve this issue, an alternative water source, farther away, with cleaner water, has been identified. By using a 28-kilometer gravity-fed pipeline to fetch this water, the long-term costs will decrease.
If the water from Homero reaches here by gravity, the cost of fuel that is being used to pump water on a daily basis will be cut off, and it means that now refugees and the host community will be receiving water by gravity from the sources, and the only cost that will be required will be maybe to maintain the residual chlorine in the water.
Issues related to sanitation are due to many problems, one of which is lack of adequate access to latrines. This is also the cause of the most common diseases affecting the camp population. Since temporary latrines are more likely to break down, refugees are forced to share limited hygienic stations.
A lot of efforts are being invested by United Nations Commissioner for Refugees, but we still have some gaps. At this point, we have a gap of around 30 latrines if you are to meet a standard.
A technological shift from temporary mobile and pit latrines to more permanent dischargeable latrines is required in order to ensure a basic level of sanitation for refugees and to reduce health risks. The environment is easily the most overlooked sector when one thinks about the needs of refugees. But without the proper setting, all essential services are at risk. The steep hills of Rwanda are vulnerable to erosion, which leads to ravines when rainwater is not properly collected and channeled through adequate drainage systems. This problem has worsened due to high rates of deforestation within and around the camps. After years of erosion at Gihembe camp, rainwater has created ravines that have gradually increased in size, even to the level of claiming lives.
Imyaka yashize mu 2010 tariki 23 z'ukwezi kwa karindwi haguyemo abana b'impunzi batatu. Icyo gihe baragiye gushaka ubutaka bwo guhoma amazu, kubera nyine urabona nta mbaraga ubutaka bufite, hahise hasenyuka abana bose bahita bapfa.
Ubwo abantu bamaze kwimuka ni abantu 4, ariko muri rusange hafashwemo abantu 13 bagomba kwimurwa bahungishwa iyo ruhurura.
A technical study has found that a total of $1.5 million is needed to address the ravine in Gihembe camp. In collaboration with Midimar, UNHCR and the local authorities are promoting mitigation measures such as tree planting in all of the camps and constructing drainage systems in the newly established camps, Mugombwa and Kigeme. Think about what you would need to feel safe and protected in life. A decent home for your family, enough food, clean water, and a chance for your children to finish school and build better lives for themselves. These are essential elements of a dignified life, and that's what UNHCR and the government of Rwanda are striving to provide for refugees.